Yes, my name is Angelia DeSalle. I was a healthcare worker. I took my first dose of the Pfizer vaccine on January the 5th, and I have been severely injured. I'm here today to report about Veris and the Louisiana Department of Health and my situation.
Have you reported before?
Yes, sir. Many times.
And so you're here to tell us that nothing's been done after you reported?
Absolutely. I have text messages from the Louisiana Department of Health and voicemails.
And what are you here to get this body to do other than what we're doing now?
To bring awareness that there are many of us out here, and we are completely left alone in this battle. We have no help. Just like the lady said, it's complete crickets. I have sent them videos of my severe neurological issues. I've been paralyzed. There's no help. None.
Well, we certainly appreciate you coming, but past what you've already done, I mean, that will be a call to all of us to try to see what we can do. But again, since you have turned this in, that kind of answers that question, which is why we're here.
Yes, sir.
So we do appreciate you coming, and hopefully they will respond to you and do something for you soon.
I hope so. There's several of us here.
Thank you for coming. I will say thank you all for coming. That's all we've got on the
Can I
agenda.
read my statement?
Yes. Oh,
Please.
yes. I'm sorry. I thought you were through.
No, sir. I do have something prepared for you guys that I worked on really hard.
We'll try to keep it under the.
I got it under
3
3.
minutes.
I promise
Yes.
I've got it
All
under
right,
3.
Go ahead.
I wanted to speak today on the Veris and our state's response to the reporting of someone injured by the COVID vaccines. As of today, I have connected with 10 residents of Louisiana that have had severe neurological symptoms after receiving their first or second dose of the vaccine, and 3 of us were here today. The article published in 2015 entitled Safety Monitoring in the Vaccine-Associated Event and Reporting System indicates that for the reports to be classified as serious, the report should include one of the following: death following a vaccine, life-threatening health event, hospitalization following a vaccine, or a lasting disability following a vaccine. My own Veris report contains 2 out of the 3 serious factors on how these reports are classified. But as of today, I have never had anyone from the CDC, the Louisiana Department of Health, or the FDA reach out and ask for my medical records. We have done our own private investigation and poll on reporting to Veris within the vaccine injury across this country. The information was collected in September by a team of us vaccine injured. 218 responded to our poll. 190 of these people had reported to Veris, while the other 28 had not. All 218 would have qualified as a severe case causing disability due to the neurological symptoms that we all had received. Out of the 190, only 11% of those had a follow-up from Veris requesting their medical information. I unfortunately fell into the category of no request for my records. I have been paralyzed 3 times since January, spent 5 days in the hospital, had around 60 office visits after my vaccine. I've literally traveled 5,200 miles across this country looking for help. Don't you think that would have been enough to alarm the Veris system to reach out to me and get me the help that I need? We injured by the COVID vaccine have been dismissed by our medical community with very little help whatsoever. We have had to reach out, do our own research, and become our own doctors to find what treatments work and what treatments do not. We are sick, and we need help, and we need to be heard. We are real people, and this has completely affected us. And I was hoping that the Louisiana Department of Health would stay so I could talk to them.
Well, they're hearing you. They're listening to you. I would say, as Representative Eccles did, one of his constituents came to him, and he brought this to us. I would say whoever represents you, and I saw Baton Rouge, right?
Marrero,
yes, whoever your representative is, and you have one, I would call that person and tell them what the problem is, and you'd like to get some answers, and they can call Secretary Phillips directly. I mean, there's no reason for you not to, if you follow the chain, to do that. And of course, you've done what you wanted to today, and you did make us aware of that. Again, this is on reporting. You did that. You've already done it, so that's part of it's done. We can't do anything about that. But
Yes, sir.
anything else, I would suggest you went deeper, and the deepest would be through your representative.
Thank you.
Thank you. Thank you for coming. Thank you, all of you, for coming and sharing your stories with us. We certainly are here to do this and give you this is the only chance citizens have to come and address us, and we do appreciate you to do that. On Representative Adams' say so, I find that he moved we adjourn. I find we adjourn.